Hi, I'm Dr. Ravikumar, one of the senior orthoplasty robotic surgeon, joint replacement surgeon from SPARSH group of hospitals. Today we'll talk about the load of arthritis in India and its impact. Arthritis is a crippling disorder which can cause pain in the knee and pain in the hips and can lead to disabilities. The load of arthritis globally is around 15% as estimated in 2022. And for our surprise, around 22% contribution or share is from India. Such a big load we have. The most important question strikes everyone: is there is any treatment for arthritis? Definitely yes. Conservative when it is in grade 1 and grade 2, and surgery when it is grade 3 and grade 4. Yeah, the most fearful issue or anxiety in not getting surgery done in India is fear of surgery. I can assure you, that with proper setup and good surgeon and a good setup, you can create results of 99.8% or 99.2% for 22.5 years survival. That's amazing. So I request each and one, whoever are a deserved candidate for surgery, has to undergo surgery. The exact number of percentage of the person who really deserves surgery and who undergoes surgery is definitely inversely proportional. Only 1% of the population of India is undergoing replacement surgery, who under 99% yet to decide. So that's why remove the fear, if required get the surgery done. When it comes to the precision and accuracy, then it's robotics. Robotics as a innovation of the 2002nd decade. So it is fortunate that we're all using it for precision work. I can assure it gives 100% replicable, mimicable and exactly reproducible results, especially in joint replacement surgery. I'm happy to announce the SPARSH group of hospital as a Mako Robotics, and we've been conducting successfully since a year. We've been around 300 odd surgeries have been done successfully. Here, the robotics is very useful in conserving the bone. As all of us know, the people awareness and capabilities of getting the surgery done for the arthritis, because of this, younger and younger population are getting operated. The joint replacement should survive around 22.5 years if it is done well. So what next after 22.5 years? If it is done through technology or robotic assisted, the balancing of the knee will be done with minimal bone resection. Minimal bone resection can make it easy when it comes for revision. So technology and experience and the Mako Robotics together can do a wonderful surgical experience for arthritic patients. In the modern era of 2023, so nothing is impossible, especially with technology. The technology assisted surgeries are big high now, especially in joint replacement surgery. Let's discuss what are the advantages of the joint replacement surgery through robotics. The first, the bone loss is very minimal. Second, the functional phenotype. There are different phenotypes from person to person. My knee phenotype may be different from my mother and father and my brothers. So through robotics, we can mimic, exactly reproduce the phenotype of our knee with technology assisted robotic surgery. That is the second advantage. Third, there are less soft tissue releases. There are less damage to the muscles and capsules attached to the bone. So that's why the systemic response is less, pain is less, and they function very fast. Fourth, they often walk very fast due to level of accuracy and level of balancing throughout the range. Fifth, the results are reproducible from each and every person through the technology. This is how, when technology is assisted with and added with experience, it gives beautiful results for the person who is suffering with arthritis and who needs surgery. The most fearful factor after the undergoing surgery for everyone, or the repeated question what has been asked in our OPD, is what next after 22.5 years. So everybody should understand, So there is a lifespan for joint replacement surgery. It should be around 20 to 22.5 years in available literature, or even more if it is done well, or if the bone quality is very good. 22.5 years later, what to do is a big question, but easy answer. At the present time, in 2023, there are every implants and instruments available to revise the failed knee. So why to suffer now? After 22.5 years from now, there might be even more sophistication, and there might be even more technology assisted, or even maybe better implants to do the revision. So in reality, the revision has become easy because of the high standard availability of the implants and instruments. So don't worry about 25 years what happens next. Think about present. It's not just for saying, it's because of the evidence and because of the availability of the implants and instruments which can make the revision easy. Total hip replacement surgery is one of the most successful surgery explained in orthopedic industry. In orthopedic complete portfolio of orthopedic procedures. Hip is a deep-seated joint, and of late the hips are getting more affected in young individuals due to the surge of the corona, and also probably due to steroid intake or the virus itself. The incidence of hip arthritis secondary to avascular necrosis, that is femoral head blood supply, is hampered due to some or other reason. The most common reason is steroid intake, followed by trauma, followed by dislocation, old fractures, and so on. So when these are considered, especially in young age, what to do? So if hip is disabled, they will not be able to walk. So for them, once again, the robotic has emerged as a bone conserving joint replacement surgery, especially for the hip, with a minimal bone removal, minimal optimal position of the implant, so that the dislocation chances are very less, and ability to walk with accuracy, early rehabilitation are just amazing. That's why the technology assisted robotic hip replacement definitely provides a better solution, especially for the young people who are suffering with hip AVN secondary to one or other reasons. The emergence of technology has made the life of orthopedic surgeon easy, especially for unicondylar knee replacement surgery. I just want to focus on this topic because unicondylar knee replacement is done for only isolated medial compartmental arthritis. In nutshell, for the general public, there are three compartments in the knee. One is outside compartment, which is called a lateral compartment. One is inside compartment, called as medial compartment. One is patellofemoral. There is a front one. Usually the medial compartment, that is the inside compartment, is affected in majority of the people. So initially that it was a technically challenging surgery and learning curve is too big. Through robotics, unicondylar knee replacement, if it is done on time for a right patient, it will survive equally as knee replacement surgery. With this unicompartmental replacement surgery, we retain the cruciate ligaments which give joint sensation to the brain, and they always feel it's like a natural joint. We can call them as a forgotten joint. So unicondylar knee replacement surgery, if it is done for a right patient in a right time through the right technology like robotic assisted, it will give wonderful satisfactory results where an individual can perform all his activities as good as with natural knees. I want to conclude, there is a huge load of arthritis in India, maybe due to our lifestyle, maybe due to our morbidity or morbid obesity, or due to our genetic characters of the cartilage. And there is a huge role of conservative management in terms of lifestyle modification, in terms of physiotherapy, and so on. But the fear of getting the surgery done has to be removed from each and everyone. It will give good results if it is done in a good place by a good surgeon with a good technology assisted surgical options like robotics. Remove the fear. If you are a deserved candidate for surgery, surgery can be chosen for your better lifestyle outcomes. Thank you.